Joint injuries can occur unexpectedly, making it essential for us to know the basics of assessment and the initial treatment. Before we delve deeper, remember, first aid isn't a replacement for expert medical care. If an emergency seems severe or if you're uncertain, always seek medical attention immediately. Let's focus on assessing a knee joint injury. Yet remember, these guidelines can apply to other joints. First, observe if there's swelling, bruising, or unnatural angles known as deformity. Remember to communicate with the injured person. Observe their pain, their movements, and ask if they've tried putting weight on their injured joint. Know any movement restrictions or any issues with circulation. If the signs are concerning, stabilize and get professional medical help immediately. If injury seems minor, following these Rice's steps and monitor if further treatment is needed. Rest. Encourage the injured person to stop any activity and keep the injured limb still and avoid putting weight on the affected joint. If you can, assist them in finding a comfortable position. If there's a significant increase in pain, do not force the movement. Ice. Applying an ice pack or cold compress wrapped in a cloth to the injured joint for at least 15 to 20 minutes at a time can help reduce pain, swelling, and inflammation. Do note that there is some discrepancy for how long or how often to use ice, as it can slow the healing process. When using ice, remember to place a barrier like a cloth between the ice pack and the skin to prevent cold injuries to the skin. Compression. Use an elastic bandage or a compression wrap to support the injured joint. Compression helps control swelling and provide stability to the injured joint. Wrapping it too tightly, though, may cause blood flow to be cut off to the rest of the limb. It's best to ensure a pulse or capillary refill is normal when you're done wrapping the injury. Elevation. If possible, raise the injured limb above the level of the heart, as this can help reduce swelling. Now, if the joint injury seems minor, home treatment may be appropriate. However, if they have any numbness, tingling, the inability to move the injury, deformity other than minor swelling, or the inability to bear weight on a lower extremity, then advanced treatment needs to happen. This leads us to the last step, splinting. Splinting is usually best left to individuals with proper training. However, there may be a need for you to splint in certain circumstances or depending on your unique profession. For example, if EMS isn't available or the patient is in an environment where they must be extricated, we may want to consider splinting prior to movement in order to minimize further injury. If no commercially available splint is available, you may consider the use of rolled-up magazines or cardboard or other rigid materials. Stabilize the injury and then use the rigid splinting material to keep the joint in a comfortable position for the patient, and be sure to splint above and below the injured area to minimize movement and prevent further harm. It's vital to practice using splinting materials often in order to improve your effectiveness and competent splinting with minimization of harm. The risk of further vascular or nerve damage should always be considered prior to manipulating a limb in order to stabilize an injury. Remember, our goal should always be to do no further harm whenever possible.